Hi, and welcome to this Business Solutions Magazine podcast and video interview. I'm Jim Roddy, the president of Jameson Publishing and Business Solutions Magazine. Thank you for joining us today. As always, we're here to provide actionable information on how VARs can sell more products, penetrate thriving vertical markets, and improve their business operations. The topic we'll discuss today is healthcare, mobility, and resellers. And our guest today to give us insight on this topic is Jacque Lapierre. He's the president of BlueStar Canada. Jacque, thank you for joining us today.
Thank you, Jim.
And so as we talked about, we want to talk about healthcare, mobility, and VARs. 2009 has been a tough year for everyone in Canada and the United States, all throughout the world. But it seems like mobility and healthcare are resisting that trend. At least that's what we've seen talking to resellers and vendors and distributors. Are you seeing the same thing?
I'm seeing quite a bit of activity on healthcare. A lot of people are talking to us about healthcare. We're attending every trade show that we find that is talking about healthcare. Actually, there are a lot of regional hospital shows that we'd love to attend, but time being concerned. But what we've seen is the shows are usually booked and difficult to get space. So the technology vendors are very opportunistic, I would say, and they're there. And when we offer for them to participate with us, they usually do so quite easily. So next week we're going to be in Quebec City in the eHealth show, and again we're expecting a good turnout and a good result out of that.
And so what is sparking this? Is this simple? Is this something that's growing, or is it that these other markets are, fading? That's why healthcare is rising to the top.
Well, there's always life cycles in markets, and some markets are obviously growing faster. The mobility segment is very strong, and mobility in healthcare, enabled by all the wireless infrastructures that have been implemented, is definitely part of that. So mobility vendors are helping VARs and software developers to bring out solutions that would help get into this market and provide a good value for the hospitals. The Canadian market is very strong on this and wants to take advantage of those technology. The patient safety is very important, and naturally budgets are very important. So both of these are good factors. Our resellers are always looking for new places to migrate to that bring good revenues, good margins, and margins associated with value. The more value they bring to an opportunity, to an environment, the better their profitability is. And we find that healthcare is providing this environment.
And we've talked about healthcare, you mentioned hospitals. Does it go beyond hospitals, though? I mean, is it really growing in other areas as well, or is it really hospitals the main thing? Are we getting all the way down to the doctors and the individual practices, things like that?
There are applications for doctors and clinics, but it's still the core focus seems to be hospitals. I think it will migrate down as the information that is captured by the hospitals is shared or accessible to the various practitioners. Then it might get to the doctors as well. A lot of doctors are equipping themselves for their own filing system, their own billing, and that's where we see them being involved at this point.
And so we're talking today here at BlueStar at their new headquarters in Kentucky, northern Kentucky. And one of the things we've talked about is your SMB focus. And so a lot of your resellers do focus on smaller, medium businesses. So it seems like getting into a hospital or hospital system could be a little bigger than some of those folks are used to. You don't just walk in the front door, talk to the receptionist, hey, I'd like to talk to the owner. And so what would a reseller need to know in order to navigate to get into a hospital?
Well, first of all, a hospital is as point of sale, as inventory control, as data tracking of all sorts, access control, safety. There's so many sub-markets in a hospital. Most of these people enter by one of these doors. There are people that are strictly hardware providers that have been fulfilling needs from hospitals from some time, but mostly when they get to the hospital, they will enter by one of these doors, whether they want to take care of inventories of the pharmacy or they're helping food delivery. All of these have their own application, their own specialists, I'd say. So it is, and that's probably why healthcare is so popular. Is it has a great diversity of applications and of needs, and obviously people are fighting to find the best avenue for their products, and hopefully make their solution the one that is the care of the day.
Mm-hmm.
I would say.
And when resellers get into a hospital, like you talked about one of these niche markets inside the hospital, do they stay in there, or are they able to grow their business and kind of add on some of the different sectors there? What have you seen your most successful resellers doing? Most
likely, I doubt I'd see somebody look after the cafeteria and the patient safety at the same time. So typically they maintain their vertical. But hospitals in Canada are not in a competitive environment, so they share technology, they share knowledge, and what will happen is one hospital will adopt something and share with the adjoining hospitals and eventually spread the solution around. So entering through one and staying in your vertical is probably one of the best way to do it.
Okay.
There are some adjoining verticals that may bridge over from your technology, but there's so much diversity that typically you have to have a strong ability to get in there.
Got it. And last question for you, Jacque, is any mobile apps that you're seeing in healthcare that VARs should learn a little bit more about? Maybe a neat one that's kind of caught your eye.
Well, one that we're working on these days is to replace the embossed cards that people are using for admission with a barcoded card or a barcoded label, which allows an easier transcription, an easier transmission both for billing and for tracking patients, issuing wristbands or sample labels for laboratory testing. Has been a great application, simple, and it doesn't impede on it doesn't have to be programmed and connected to the ERP in place in the hospital. It's a standalone solution that actually gets fed by the ERP. But that's one of the good solutions we've seen. I know that mobility and communications within the hospital are very strong. I've seen various vendor Motorola is introducing a new device which will allow communication instantly between people in different areas of the hospital using the wireless access. There are a variety of those applications out there. I'm always surprised how much imagination people put in it.
Yeah.
It's great. That's what makes this industry interesting.
Yeah, tough economy, but the innovation keeps on coming. People
That's
don't
right.
stop thinking.
That's the way to go.
Well, thank you for your time today, and that's all the time that we have for you today. Hopefully our discussion has given you not just some background on healthcare and mobility, but also some actionable information that you as a reseller can apply to help grow your business. So before we go, I want to say a few thank yous. First, thank you to Jacque for joining us today, and thank you for your time. And thank you for BlueStar to inviting us to be the first media partner to tour their headquarters. We've spent time today with their staff, and it's been a good experience to see how they've implemented a lot of the technologies that you resell into their own business. And thank you to you so much for listening to this podcast and watching this video interview. Our goal at Business Solutions is to provide growth strategies for the IT channel. For more information, please visit our website at www.bsminfo.com.